This man, Dr. Jack Kevorkian, was a famously extreme advocate for euthanasia. He was so famous that the band Gotham City had wrote a song titled Dr. Kevorkian and the Suicide Machine. Dr. Kevorkian had gained his fame for his assistance in over 100 patient suicides, many of whom were terminally ill. Dr. Kevorkian had attended the University of Michigan Medical School in the 1950s, and then post-graduation, as a pathology resident, Dr. Kevorkian had strayed from the medical mainstream and advocated for experiments to be done on death row inmates at the hour of their execution and prior to giving them their lethal injections. This is what earned him the title of Dr. Death. Later on, in the 1960s and 70s, Dr. Kevorkian advocated for the establishment of suicide clinics, known as ovatoria, and worked as a pathologist in hospitals in Michigan and California. In 1982, he retired and began to work on his final mission, and that was helping patients end their lives. Dr. Kevorkian had then gained international attention and fame in 1990 when he enabled a 54-year-old woman with early-stage Alzheimer's disease, Miss Janet Adkins of Portland, Oregon, to kill herself using his invention of the Mercitron machine. The Mercitron machine is one of several suicide machines invented by Dr. Kevorkian. Dr. Kevorkian had several other suicide machines that practiced various methods of euthanasia, such as lethal injection. But the Mercitron machine had an oxygen mask attached to a canister of carbon monoxide. So this one wasn't lethal injection. It was just a means of suffocation. Dr. Kevorkian attended his patients' suicides as a statement to the medical community regarding their need for the confrontation of ethical issues that inhibit medical treatment. Medical ethicists and practitioners alike criticized Dr. Kevorkian on his actions, saying that they violated the sacred Hippocratic oath of do no harm. Dr. Kevorkian argued that he had cared for nothing more than the welfare of the patients he was treating, and that by standing by and allowing them to suffer, rather than doing the patient a service of euthanasia, was actually more harmful to the patient overall. Now, in November and December, Dr. Kevorkian had served 2 jail sentences due to his violation of euthanasia laws. In November, he was released due to his hunger strike and threats to starve himself in his protest of the immoral laws against euthanasia. On his release, he attended the suicide of his patient Khalil and was then taken back to jail for his second sentence in December. In his second jail sentence, Dr. Kevorkian was sent into yet another self-proclaimed hunger strike in protest. This hunger strike had left him very frail and weakened, and he was released a second time on December 17, 1993. Due to these sentences, Dr. Kevorkian's medical license was revoked. Now on to his prison sentence. On December 18th, Wayne County, Michigan had deemed laws against assisted suicide as unconstitutional, but this did not reach the neighboring county in which Dr. Kevorkian resided. Years later, in 1998, Dr. Kevorkian had aired on a news program, 60 Minutes, where he administered a lethal injection to a patient suffering from Lou Gehrig's disease. For this, Dr. Kevorkian was charged with first-degree murder for performing assisted suicide in an area where assisted suicide was banned, as well as for administering a controlled medication without a medical license. He was then sentenced 10 to 25 years in prison, released, and paroled after 8 years in 2007 for good behavior. A year following his prison release, Dr. Kevorkian campaigned for a seat on the U.S. Congress, representing the suburbs of Detroit. His campaign, however, was unsuccessful. On June 3, 2011, 8 days after his 83rd birthday, Dr. Jack Kevorkian died peacefully of a thrombosis. And that is the story of Dr. Death. Whether he died a hero or a murderer, I leave that to your discretion.